In our everyday lives, we talk about everything from relationships to recipes, from finding your purpose to finding the perfect pair of jeans. We laughed together, we cried together, and through it all, we learned from each other. But there's one thing we don't always talk about, something that's so essential to living your best life: mental health. Mental health is just as important as physical health, yet many people struggle in silence. Today we're exploring some of the most common mental health conditions, what they are, how they affect us, and how we can seek help. Let's talk about anxiety. Now, we all feel anxious sometimes, right? It's that nervous energy before a big presentation or a first date. But for millions of people, anxiety is more than just butterflies in their stomach. It's a constant companion that casts a shadow over their lives. Imagine feeling that knot in your stomach, that racing heart, that sense of dread, almost all the time. That's what it can be like to live with an anxiety disorder. Whether it's generalized anxiety disorder, where worry feels like a relentless wave, or panic disorder with its sudden and terrifying panic attacks, or social anxiety, which makes social situations feel like an insurmountable challenge, anxiety disorders can be debilitating. But here's the thing, you don't have to suffer in silence. Therapy can provide coping mechanisms and strategies to manage anxiety. It's about understanding your triggers, learning to challenge negative thoughts, and finding ways to calm your mind and body. Depression is more than just feeling sad. It's a serious medical condition that affects every aspect of your life: your mood, your energy, your sleep, your appetite, even your ability to enjoy things you once loved. It's like a heavy cloak that weighs you down, making it hard to find the energy to get out of bed in the morning. You might feel hopeless, like nothing will ever get better. You might lose interest in things you used to be passionate about. You might feel worthless, like you're a burden to others. But here's what I want you to know. Depression is not a sign of weakness. It's not something you can just snap out of. It's an illness, just like any other illness, and it can be treated. Bipolar disorder is like riding an emotional roller coaster. There are intense highs and crushing lows with periods of relative stability in between. During a manic episode, you might feel euphoric, energetic, and invincible. You might have racing thoughts, talk a mile a minute, and engage in risky behavior. But then comes the crash, the depressive episode, with its overwhelming sadness, fatigue, and loss of interest in life. It's a challenging condition, no doubt, but with the right treatment plan, people with bipolar disorder can live full and meaningful lives. Medication can help stabilize mood swings, while therapy provides coping skills and support. OCD, breaking free from intrusive thoughts and behaviors. Have you ever had a song stuck in your head that you just couldn't shake? Or double-checked that the stove was off even though you knew you'd already turned it off? We all have our little quirks, but for someone with obsessive-compulsive disorder, or OCD, intrusive thoughts and repetitive behaviors take center stage. These obsessions, these unwanted thoughts or images, can be incredibly distressing, leading to compulsions, repetitive behaviors that offer temporary relief from the anxiety. It might be excessive hand-washing, counting, checking, or arranging things in a particular way. It's a vicious cycle, but therapy, particularly a type called exposure and response prevention, or ERP, can help break it. Healing from trauma. Understanding PTSD. Trauma can leave invisible scars that run deep. Post-traumatic stress disorder, or PTSD, can develop after experiencing or witnessing a terrifying event, a car accident, a natural disaster, physical or sexual assault, or combat. It's like your body and mind get stuck in survival mode, even when the danger has passed. You might experience flashbacks, vivid memories that transport you right back to the trauma. You might have nightmares or trouble sleeping. You might feel constantly on edge, easily startled, or have difficulty concentrating. But even in the darkest of times, there is hope for healing. ADHD, more than just not paying attention. We often think of ADHD as a childhood disorder, And while it's often diagnosed in children, it can affect adults too. ADHD is about more than just fidgeting or having trouble sitting still. It's about challenges with focus, impulse control, and executive functioning. The skills we need to plan, organize, and prioritize. Imagine struggling to stay focused on a task, even when you're genuinely interested. Imagine feeling restless, like your brain is constantly in overdrive. Imagine having difficulty controlling impulsive behaviors, like interrupting others or making rash decisions. That's the reality for many people with ADHD. You are not alone. Seeking help and breaking the stigma. If you see yourself in any of these conditions, know this: you are not alone. And you don't have to suffer in silence. There is no shame in seeking help. In fact, it's one of the bravest things you can do for yourself. Talk to your doctor, a therapist, a counselor. Explore different treatment options, therapy, medication, support groups, lifestyle changes. For too long, mental health has been shrouded in stigma and shame. But it's time to break the silence. It's time to talk about mental health as openly and honestly as we talk about physical health. Because just like we wouldn't hesitate to seek help for a broken bone, we shouldn't hesitate to seek help for a broken mind. Outro: a world of support. Remember, mental health matters. Every single one of us has mental health, just like we have physical health. And just like we take care of our bodies, we need to take care of our minds. Understanding these conditions, being able to recognize the signs, and knowing where to turn for help, that's how we break down stigma and create a world where everyone feels comfortable seeking the support they deserve. Mental health matters, and understanding these conditions helps break the stigma. Let's support each other and create a world where talking about mental health is as normal as talking about physical health.